Hello everyone. Today we will discuss about the gastrointestinal lesions in diabetes. However, the disorders of gastrointestinal system in diabetes have not been explored much. The gastrointestinal system in diabetes involves all the organs in the body, and the involvement of this gastrointestinal system organs is presented usually as either dyspepsia or heartburn or indigestion. The dyspepsia is an episodic or recurrent pain or discomfort, usually in the upper GI tract, and it is related with the eating something, and usually it is associated with heartburn and indigestion and acid reflux. The heartburn is a pain that is feel like something burning on the chest, and this heartburn is usually associated with reflux of digestive acid in the stomach or esophagus. This indigestion is also pain or discomfort in the stomach, and it happens usually when the stomach is not able to deal with food or not able to digest the food. Approx 75% of the patients with diabetes, they show gastrointestinal symptoms. However, the disorders of GI systems in diabetes have not been explored much. Now let's discuss about the pathogenesis of these GI disorders in diabetes. If in any patient of diabetes there is poor glycemic control, or if the complication of diabetes, that is diabetic neuropathy, is already been developed in a patient with diabetes, so both of these leads to development of motor dysfunction in the gastrointestinal system of the patient, and it ultimately leads to development of various GI disorders. So what are the common complications of GIT which are found in any patient with diabetes? So these common complications are gastroesophageal reflux disease GERD, esophageal dysmotility, enteropathy, gastroparesis, glycogenic hepatopathy, and non-alcoholic fatty liver disease. About this non-alcoholic fatty liver disease we have already discussed in a video. If you want to follow this video, you can follow this link on I button. Now let's discussing to the autoimmune diseases of GIT. So it is found that the patient with type 1 diabetes mellitus have higher incidence of having these autoimmune diseases of gastrointestinal tract, and the reason behind this is that the common environment and genetic risk factor for type 1 diabetes mellitus as well as for this autoimmune diseases. These autoimmune diseases of GIT which are common in type 1 diabetes include autoimmune gastritis, the celiac disease, and the Crohn's disease. Now let's discuss what is the pathology of development of these autoimmune diseases of GIT in any patient with diabetes. So in diabetes, the chronic hyperglycemia it damages the menintic neurons of the various organs of the GI system. These menintic neurons are the neurons which are lies between the outer longitudinal and inner circular smooth muscle layer of the intestine. Because of this, it affects the functioning of stomach, esophagus, and small intestine. Apart from that, there are various other factors which also contribute to develop this GI pathology in any patient with diabetes. These are, as the diabetic neuropathy is a common complication in any patient with diabetes, it affects the salivary gland and its secretion in diabetes. It is also found that it delays the gastric emptying. Due to development of motor and autonomic neuropathy in diabetes, it reduces acid clearance from the esophagus and stomach. Sensory nerves of esophagus are found to be damaged in diabetes. Apart from that, there is lower esophageal sphincter dysfunction, and it occurs due to the autonomic neuropathy in diabetes. Apart from that, the diabetes also affects the peristaltic wave transmission of the intestine. Let's discuss about the esophageal dysmotility. The esophageal dysmotility is a condition when the foods and liquids they are not easily passed down the esophagus into the stomach. and it is usually found in the long standing diabetes cases, and this long standing diabetes usually affects the nerve supply of the lower esophageal sphincter, which ultimately causes the esophageal dysmotility. The esophageal dysmotility in any patient with diabetes can also occur due to the alteration in the basal lower esophageal sphincter, which is located here, and it also affects the peristaltic movements from this esophagus. It is seen that about 50% of the patient with diabetes, they are suffering from the esophageal dysmotility, or about 50% of the patient with diabetes usually suffer from this esophageal dysmotility. The presence of diabetic retinopathy in any patient with diabetes can be a good indicator of presence of esophageal dysmotility. This esophageal dysmotility can be influenced by the duration and control of the diabetes in such patients. Apart from that, it is also influenced by the development of autoimmune neuropathy in diabetic patients. It is also found that in aged patients, the lower esophageal sphincter tone is also reduced very badly, and it is also correlated with the degeneration of the vagal fibers in aged patients. Apart from affecting the lower esophageal tone and pressure, it is found that the amplitude and velocity of the peristaltic movement of the esophagus is also affected in diabetes. This esophageal dysmotility can present in any patient with diabetes as dyspepsia and retroesternal burning sensation. For diagnosis of this esophageal dysmotility, we can carry out high resolution manometry and esophageal pH monitoring. By high resolution manometry, we can measure the pressure of lower esophageal pressure, and by esophageal pH monitoring, we can measure the pH level of lower esophageal region. If the pH goes towards the more acidic region, so it indicates the presence of any acid reflux in such patient of esophageal dysmotility. Now coming to the gastroesophageal reflux disease, also known as GERD. This gastroesophageal reflux disease can manifested as heartburn, that is pain in the chest region, dysphagia, that is difficulty in swallowing of food and liquid, and regurgitation. The regurgitation is the spitting up of the food from the esophagus or stomach. And for development of this gastroesophageal reflux disease, diabetes is a major risk factor. It is also seen that this GERD, gastroesophageal reflux disease in diabetes, can impair the glycemic control in any patient with diabetes. Why? It is because of the reduced tolerance of the oral medications by such persons, as we have seen that regurgitation is very common in this GERD. Apart from that, the autonomic neuropathy in diabetes can lead to esophageal dysmotility, as we have already discussed, and this esophageal dysmotility can lead to relaxation of the esophageal sphincter, which will further lead to this development of gastroesophageal reflux disease, as the reflux will be very common after the relaxation of this sphincter. As this can be better understood by this diagram, this diabetes can lead to development of esophageal adenocarcinoma, as the GERD, gastroesophageal reflux disease, which is very common in a patient with diabetes, is also a risk factor to develop this esophageal adenocarcinoma. Apart from that, this GERD can also lead to development of Barrett's esophagus, which is a precancerous condition. How we can diagnose this GERD? So this can be diagnosed by the presence of symptoms of GERD, which we have already discussed. Apart from that, we can carry out the GI endoscopy, and if there is appearance of mucosal changes in the esophagus. So what are the management methods for the GERD? So this can be done by the lifestyle changes, by like weight management, the cessation of smoking, and by the pharmacotherapy using prokinetic drugs and proton pump inhibitors. The examples of these prokinetic drugs are metoclopramide, the domperidone, cisapride, etc. The examples of these proton pump inhibitors are pantoprazole, omeprazole, rabeprazole, etc. Now discussing to the gastroparesis. The gastroparesis is a condition when there is food is retained in the stomach, or there is delayed gastric emptying, and this happens without presence of any organic obstruction in the GIT. As in these pictures we can see, in normal condition the gastric emptying took place because of the contraction of the muscles which are present in the stomach, and due to this muscle contraction the food passes through the digestive tract. However, in gastroparesis there are complex pathology which involves the causation of this retention of food items in the stomach. These pathologies of gastroparesis are usually poorly understood mechanisms, and these include the loss of migratory motor complex in stomach, the blunting of antral contractions, the pyloric spasm, and poor meal accommodation in the stomach. Apart from that, there are few studies which suggest the involvement of inhibitory neurons and interstitial cells of Kajal behind the occurrence of this gastroparesis. Usually, these interstitial cells of Kajal, they function like pacemakers of the intestine, and usually these are found in the circular muscles in the intestine. This delayed emptying of the gastric content also compromises the glycemic control in any patient with diabetes. And for diagnosis of this gastroparesis, a method is applied which is known as gastric emptying scintigraphy with actinium, and it is considered as a gold standard method for diagnosis of this gastroparesis. For the treatment of gastroparesis, we can give the prokinetic drugs, and apart from that, we can also explore the endoscopic and surgical treatment method. The another disorder of GI system in a patient with diabetes is diabetic enteropathy. This diabetic enteropathy is a type of nerve damage which usually affects the GI system or digestive system in any patient with diabetes. This diabetic enteropathy can present with diarrhea or constipation or fecal incontinence, and the main pathology behind this development of diabetic enteropathy is that in diabetes there is production of advanced glycation end products is common, which damages the epithelium and neurons which are present in the small intestine. It also causes the stasis or accumulation of the intestinal content. If the neurons of GI system are further damaged, then this will lead to development of fibrosis of the intestinal muscles. This autonomic neuropathy of diabetes can affect the functioning of the internal and external sphincter, and it leads to fecal incontinence. For the treatment of diabetic enteropathy, we can prescribe the broad spectrum antibiotics and lactulose to the patient. There is another condition which is common in patients with diabetes is glycogenic hepatopathy, and this glycogenic hepatopathy is common in long-standing poorly controlled type 1 diabetes. This leads to enlargement of the liver. Apart from that, this glycogenic hepatopathy will be presented as deranged liver enzymes and as well as the accumulation of the glycogen within the hepatocytes. Now we are at the end of this video. If you have liked this video, please share with others. Thanks for watching.